Tuskegee, Alabama, 1932. The United States Public Health Service begins a study involving approximately 625 black men called the Tuskegee Study of Untreated Syphilis in the Negro Male. For 40 years, the study was conducted without offering participants effective treatment and without their informed consent. This and other similarly egregious civil rights violations have resulted in a pervasive and persistent distrust of the medical establishment by the black community, with consequences that continue to impact the health and well-being of black people today.
One of the reasons that cited for the hesitancy among African Americans in taking the vaccine for COVID-19 is what happened in Tuskegee, Alabama. It was a horrendous violation of ethical standards, a violation of human rights, and one more example of the savage racism that is the history in this country. People may not realize how trauma moves through generations.
In what many are now calling intergenerational trauma. It impacts families, it impacts communities, and that's really what we're seeing with the hesitancy with this vaccine. There's knowledge of past abuses.
Descendants of the men involved in the study of untreated syphilis have formed an organization called Voices for Our Fathers Legacy Foundation. Their aim is to educate Americans about the harms caused by systemic racism while also focusing on the future.
When I asked my father how he felt about being in the study, he said, I can't do anything about what has happened to me and all of those other men. He said, but it's up to you all to make sure that it doesn't happen again. That's what we are trying to do. I always felt as though we shouldn't dwell always on what we cannot do, but we look to what we can do. This is something that we can do, is to transform that legacy.
We're at the intersection of faith and medicine and past and present. And we really need to talk about these things in the African American community to move forward and bridge a better path to the future.
One key difference between the past and the present is the level of involvement of black people in the public health initiatives, such as the development of the current COVID-19 vaccines.
I think that that's really important for people to understand that all along the way that black people have been involved, have been invested.
We have all heard of Dr. Corbett, and she has been instrumental in working with the Moderna vaccine. One of the lead scientists worked on this vaccine, and we had our race really being involved in clinical trials.
We've got a long way to go, and our trauma is real. Nobody's crazy here. What we know is what we absolutely know. But we're not going out this way. We have got to stay on the battlefield. We need to watch the vaccine distribution. It's not going to be equitable if we don't continue to make noise about it.
So one of the things that I really feel strongly about is patients having total informed consent and just being upfront and honest about everything.
The data shows that the vaccines are safe, they're effective, and we want to get as many people vaccinated so we can protect others around us. In the Black and brown community, if a lot of people don't take the vaccine, then we won't get to herd immunity, right? And there'll be more deaths. So that becomes really important.
I would like to encourage everyone to consider, if they can tolerate it, to get the vaccine, because it's so important. It is devastating our Black community, and we really need to get involved and help and make sure that it doesn't continue.